Good morning. I'm Carla Beckerly, adult nurse practitioner and on the board of St. Louis and Advanced Practice Nurses, and we are giving you this series of information about different topics for Nurses Week and Nurse Practitioner Week this past week. The thing that I'm going to talk about are the 5 myths that are generated around coronavirus. The first myth is that you can get it only once, which many of you know this is not true. Incubation period is 2 to 14 days, with many individuals getting the virus and showing signs and symptoms at the median of day 5. And the coronavirus itself, once you've had it, it provides immunity for 3 months. And so if you are exposed again after 3 months, you can get it again. Myth number 1. Myth number 2, that basically a lot of people I know have said all masks are the same. That's untrue. All masks are not. The gaiters, the cloth masks, etc., provide some protection, but not optimal protection as a healthcare provider. The surgical masks provide good protection if you're seeing a patient or if you're involved with a task that would potentiate your exposure for less than 15 minutes. The best mask for those folks that are taking care of patients for greater than 15 minutes who are potentially exposed are the N95s. And many of you are aware of this, and that's what you're using in your clinical settings. Myth number 2. Okay, so myth number 3 is that COVID-19 testing can be done anytime after exposure. We all know that it's a 2 to 14 day potential incubation period. So if you test on day 1 after exposure, you may get a false negative. Test after the 48 hours is the preferred, and many people get the symptoms at between day 2 and day 5, and so anytime after that is appropriate. Myth number 4. Vitamins and supplements can prevent coronavirus and prevent you from having symptoms. While they do provide some boost to immunity, they don't. There's no food or supplements or vitamins that can prevent coronavirus. But vitamins C, D, and zinc are being seen as things that do boost your immunity, so wouldn't hurt. The last myth is that there's only one strain of coronavirus, COVID-19. That's untrue. There are between 6 and 8 strains, depending on who you look at in the literature and what source you look at, but between 6 and 8. And there are 4 subgroups: alpha, beta, delta, and gamma. So there are a lot of things that you're going to be asked in your clinical practices, a lot of things that people are worrying about, a lot of things that need clarification. And we wanted to give you a Mythbusters for 5 of the common questions. Have a great weekend, and thank you for what you do as nurse practitioners. Carla Beckerly.